What is a good everyday carry medical? Let's talk about that. Welcome to the Patriot Training YouTube channel. My name is Clay Howell, owner and head firearms instructor at Patriot Training. The topic of this video is everyday carry medical. I would suggest if you carry a gun for self-defense that you also carry medical equipment to stop catastrophic bleeding. In addition to this equipment, of course, and I'm sure you could predict this, I would highly recommend some training to go along with it. Starting with a TCCC class or a stop the bleed, that'd be a great starting point. You need to learn how to control massive hemorrhage by way of tourniquets, by way of wound packing, by way of pressure dressing, and by way of chest seals. These things are absolutely critical knowledge, and there's no reason every civilian can't get this knowledge. And the neat thing about medical knowledge is this transcends the firearms community. Thank God, at 48 years of age, I've never had to draw my gun in self-defense. But you know what? I have had to use medical on more than one occasion. And I'm glad I had that knowledge. And believe me, the people that I helped were really glad I had that knowledge. And above and beyond that, the medical classes that have been taught by Patriot Training, we've had several of those students go on and render medical aid as well above and beyond that. And ladies and gentlemen, that's the thing I'm most proud of at Patriot Training, is we have helped others to save lives when the time came. And that's the purpose of carrying medical equipment on you, because if you don't know how to use it and if you don't have the equipment, it's really, really hard to stop that catastrophic bleeding. The old days of the Boy Scout of using a belt and twisting with a stick, we all know that doesn't work. In fact, there's been trials where that's been proven not to work. So, yeah. And these days, a good tourniquet is $30-35. There's no reason not to carry one. I outfit every single car in my household with one, and all of the members of my family are well trained in the art of, stopping massive hemorrhaging, with tourniquets, wound packing, chest seals, pressure dressings, those sorts of things. So you should make this a priority for your family as well. And I'm going to tell you, my kids have been doing this stuff since they were very small, since they were under the age of 10, and they really enjoy it. They like it. And believe it or not, my son has had to use his training already. And as of the filming of this video, he's 19 years of age. He's a freshman in college, and he has had to use the medical training. So goes to show you, get the medical training, carry the equipment with you. What do I carry? Well, let's go through that. First thing is I carry a tourniquet. I choose the SAM XT tourniquet. For somebody that does not know, what happened is the SAM XT tourniquet is a lot like a CAT Generation 7 tourniquet. The difference is, and if you ask anybody who knows anything about EMS, the number one cause of tourniquet failure, even when applied by EMS professionals, is failure to get the strap tight enough. And what the SAM XT does is it gives you a signal when that strap is tight enough. And that audible click that you can feel as well tells you that tourniquet strap is tight enough. You may now begin applying the windlass. And that's why I choose the SAM XT. The second thing that I carry on my person is I carry gauze for wound packing. I can also take some of this gauze and bunch it up together and form something with which I could create a pressure dressing. Now, that's all I carry on my body. I always have a pocket knife on me, so if I need to take off some clothing, I can do that, although that's not the recommended way. I keep a really good set of medical shears, and we're talking about, EMS grade medical shears that I keep in my vehicle, because I'll have a moment to get those. And you say, well, no, not if there's massive bleeding. If there's massive bleeding, I'm going to apply the tourniquet, or I'm going to start packing the wound, period. And then I can go get the shears later and get the area exposed and search for more wounds. Likewise, I carry a chest seal in my car. And again, the reason why, after consulting with multiple paramedics, multiple EMTs, multiple ER doctors, I have come to the conclusion they all say that if the chest seal, if me having it on me versus me taking 2 minutes to go to my car and get it, if that person dies in that 2 minutes, the chest seal was not going to save them anyway, is their consensus. So I'm going to go with that. Thank God I've never had to apply a chest seal, really super quick. But it's also my observation, I've had about 2 or 3 people I know need a chest seal, had a sucking chest wound, and one of them didn't get treatment for over an hour and was just perfectly fine. The pressure was gradually building, and it's my understanding from reading, researching, and speaking to medical professionals that's generally about how it goes. So I keep my chest seal in my car. Also, I keep my Israeli bandage in the car. And for an Israeli bandage, I use the Olaes. And the Olaes system, this one's in a wrapper, but this one has been unwrapped. The Olaes system, if you haven't seen this, this is just really good medical kit. First and foremost, it is an Israeli bandage, and you can see this pressure cup right here, where when you're wrapping round and round and round, this applies pressure to the wound. Secondly, there is gauze inside here, Z-folded gauze that can be used for pressure dressing or for wound packing, either or. Third, as you see, when I unroll this, there's going to come times where these little Velcro hook and loop attachments retain to the wrap. And if you've ever done any kind of Israeli bandage practice or actual use, sometimes you'll get it wrapped around, then you let go accidentally. Things happen, crap happens, especially if you're under pressure. So what this wrap does is I have wrapped this around something, and these hook and loop, once it hooks in, if you drop it, you don't lose where you're at. You can keep on going. You can pick up where you left off, basically. So that's why I recommend the Olaes bandage. Plus, right now, as of the filming of this video, an Olaes bandage is only about $2 more than the actual gauze for wound packing. So the vacuum seal gauze. So I carry both, but if you can only get one, get the Olaes bandage and carry that, because it's got so many functions. It also has an occlusive dressing, which is kind of like a piece of plastic inside, so that you can treat multiple wounds if need be. Really good piece of kit. I wholeheartedly recommend the Olaes bandage. And again, I keep that one in my car, because if I don't have 2 minutes to go and get my Israeli bandage, then this person needs a wound pack or a tourniquet. They need something much more substantial than just an Israeli bandage. So I've got a minute to go get that and come back and finish treating the patient at the scene and awaiting EMS. Well, folks, that's about all for this video. I'd like to thank you for tuning in. Hit like, hit subscribe, click that notification bell so that you can learn when the new Patriot Training videos come out. Leave a comment. Do you carry something different? I'm a huge fan of CAT Generation 7 tourniquets. The medical bag I keep at firearms classes is chock full of some CAT Gen 7s and Olaes bandages and pressure dressing. So if you carry something different, tell me about it. If you disagree with me, I really would like to see your points, and I'd like to hear what you feel, and if you've got some research that contradicts what I say, put it in the comments, by all means. I'm not the end-all be-all when it comes to medical knowledge. I'm always learning, and I'd love to learn something. So if you've got something to share, please leave it. And that said, I'd like to remind you, you don't have to be a patriot to train, but you do have to train if you want to be a patriot. Take care.